Good morning, everyone. Thank you for joining us. My name's Meg Viss. Really glad to have you all with us on this, on the surface, perhaps not an overly exciting topic, but it is a very exciting topic and a vital one. So I'm going to share my screen to get us started. Looks good, guys. You good? Excellent. Okay. So welcome. Tuesday, November 8th, and today we're talking about the importance of preventing falls and injuries. Just a couple of things. Appreciate if everyone could mute their mics just to block out any outside noises, animals, coughing. Because we were not able to get an interpreter for this one, we do have captioning for you at the bottom of the screen. And we'd appreciate if you could put your questions and comments in chat. Sherry's going to be monitoring that for us. And at the end of the presentation, we'll have, at the end of the presentation, we'll dive into that. The session is being recorded, that was announced. And at any point, you can throw it into chat or save it to the end. But if you have any suggestions for presentations, we welcome that. And I'm going to ask Barb to do the land acknowledgement, please.
Good morning. We respectfully acknowledge the land on which we gather as the ancestral homelands of the Beothuk, whose cultures has now been erased forever. We also acknowledge the island of Ukta-Hunguk as the unceded traditional territory of the Beothuk and the Mi'kmaq. And we acknowledge Labrador as the traditional and ancestral homelands of the Innu of Nitassinan and the Inuit of Nunavut and the Inuit of Nunatuavut. We recognize all First Peoples who were here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be the responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all.
Thank you, Barb.
Welcome.
So when you registered, we asked you a question. Have you or someone you know required medical attention as a result of a fall? Indicating that it's obviously bad enough that you needed to engage that. So 2/3 of you responded in the affirmative. 70% of you said that you or someone you know has required medical attention as a result of a fall. That's pretty significant. And the reason why that's so significant is because as we age, falling has the power to become a game changer. I'm sure all of us know someone who's had a fall that changed things irreversibly. Most of the time that's not the case, but it does have that power. And as we age, that power becomes stronger. And whether it's a sprained ankle or a broken hip, or perhaps even something more severe, recovery can generally take a little longer than we certainly expected. And in some cases, we may never get back to exactly where we were before that fall. So if all of that is true, and it is, prevention is the name of the game, and that is what today's presentation is all about. We have 2 presenters with us. I'd like to introduce...
You want to put up a chair?
No, I can't.
Hang on a sec. I'm going to introduce Corinne Power. Corinne is an occupational therapist, and she has over 20 years of experience in occupational rehab, ergonomics, job site analysis, and cognitive rehab. She researched and implemented the Safe Resident Handling and Movement Program in long-term care facilities since 2009. Her work includes safe transfers, home demand analysis and renovation, and personal care assessment. She's currently team lead with community supports in the Western Health region And she enjoys working with seniors to maintain or increase their independence in their daily activities and mobility while preventing risk of injury and keeping safe at home and in the community. I'd also like to introduce, if I can get this to go down, Brittany Murphy. Brittany is a physiotherapist. She also works with Western Health in Corner Brook as a community support physiotherapist. She had worked in private practice for a number of years, where she completed the falls and injury prevention sessions, as well as seniors' fall prevention exercise program. Brittany led the implementation of a standardized exercise program in personal care homes in the Western region to prevent falls and injury, and currently works individually with seniors in the community to provide exercise programs. And Brittany has a passion for seniors' health, and even more specifically for falls prevention education and interventions, which is what we're going to focus on here today. So I'm going to stop sharing my screen, and I'm going to ask Brittany and Corinne to share theirs and take us through their knowledge.
Perfect. Thank you, Meg. I'm just going to get that up there now. Okay, how's that looking?
Perfect.
Perfect. Okay, so thank you for the introduction. So I'm going to start us off. I'm Brittany, the physiotherapist. So we're going to look at falls and injury prevention for seniors and how you can minimize your risk. So a little overview of what we're going to talk about. So we're going to talk a few facts about falls, look at what successful aging looks like, why seniors are at a higher risk for falls and injury, how we can decrease risk for falls, which I think is the main thing everyone's probably here for, what to do if you do fall and how to get up from a fall, some benefits of exercise and specific recommendations for that, and then how will you know when it's time to get some help or assistance. So, falls are quite common. So it's estimated that 1 in 3 seniors fall at least once per year. We're looking at 50% of seniors over the age of 80 falling each year, and half of those fall 2 or more times in the year. Falls cause 95% of all hip fractures. And those 65 plus, falls are the leading cause of injury that result in hospitalization and death. And falls cause 85% of seniors' injuries that result in hospitalizations. So this just kind of shows the importance of falls prevention and what we're chatting about today. But there's also good news. So falls are not a normal part of aging. So, it's one of those somewhat misconceptions that if you are becoming older and getting into that senior's age, that it's inevitable that, you're going to have falls, but that isn't the case. And that's why we're talking about prevention today. So some of the other reasons why it's really important that we reduce falls, it's not just about that specific injury, that hip fracture. We also know that falls can lead to chronic pain, a loss of confidence to be mobile and loss of independence, a fear of falling, which we actually know when we have a fear of falling, that leads to a high risk of falls. So it can be a bit of a snowball effect. And that can lead to some depression and anxiety about that loss of independence. Activity restrictions, so some of those activities that we were once able to do, now we're not able to do after a fall. And it can result in social isolation at times if the injuries are significant enough and if that fear becomes significant enough. So I want to kind of talk about successful aging. So what us specifically as rehab professionals, where our job comes in. So we think about healthcare over the years and, we've done an excellent job in extending the lifespan of our population. So that's great, right? We have this longer length of time where we're enjoying, but we want to be able to enjoy that life. So what we look at, this morbidity piece, is when we had that onset of disability. So what we as rehab professionals want to do is bring that line as close to the end as possible so that you have lots of life of quality where you're not having injury and disability. So that little line of disability is really close to the end. It's not kind of taking up a whole huge chunk of your life. So we're not looking at length, we're looking at quality here, right? That's what we want to see. And so there's a few little pieces that we look at for successful aging as well. So kind of one of the things that's more a draw for healthcare is avoiding disease and disability, right? That's a huge part of that, what someone would categorize as successful aging. But we also need that engagement with life, right? Having that full engagement and then having that high cognitive and physical function. And all of this works together. So it's not, they're kind of in silos, but then they overlap, which is what we're kind of showing in that diagram. So why are seniors at high risk for just in general injury? We'll start with. So what we have is some kind of changes in tissues throughout our body. So we have a decreased muscle activation and length. So our muscles are a little bit tighter. They're not kind of kicking in as fast naturally, but there's ways to prevent it. So I don't want to have this as like, okay, this is the way it is. Like I said, it's not necessarily a normal part of aging. We're seeing these changes, but there's ways to not see that translate into our daily lives and function. You probably heard, bone density decreases over time. Balance can decrease. Our vision needs a little bit more attention as we age. And then we have that, we're seeing those numbers of increased falls and extra need because of that increased length of life. We're looking at some medications to help manage certain medical conditions. And some of those medications put us at a little bit higher risk. Now, a lot of them are needed, but it can sometimes even just be a combination. And we'll talk about that a little bit later. Oh, there's all kinds of reasons for why we're at risk of falling. So I'm going to go through a few things, kind of some general ones, and then we're going to kind of go into a little bit more detail about specifics before we then delve into how to reduce risk. So some of the other risks of falling: dizziness, postural hypotension. So people with blood pressure fluctuations, if you get up too fast, you're feeling that dizziness come on. So that puts us at a little bit more risk. The next one is a big one in the research lately. We're seeing a huge linkage between hearing loss and falls. Wow. So having that not managed can be a huge risk. Certain medical conditions, such as, diabetes, if you had a diabetic neuropathy, not being able to feel the bottoms of your feet on the ground as well, that can put you at higher risk. And that comes in with that decreased sensation, but that could be diabetic neuropathy, or it could be just generalized decreased sensation. General pain, that could be from arthritis or other injuries we've had when we were younger. Balance and walking problems, certain foot problems and conditions. And then we'll go to the next. So we have some changes in our function and ADL impairment. So that would be our activities of daily living, such as dressing and bathing. There's a chance for cognitive impairments that put us at a little bit of risk. So if we're not can't fully remember to take that gait aid with us, and things like that can put us at a bit of risk. Poor nutrition and hydration. So sometimes appetite levels can change, and we might have to be a little bit more specific in how we get that nutrition, making sure we're getting in the stuff that gives us our energy. Excessive alcohol use puts you at high risk. I think that's an obvious one when you're actually having alcohol. And then we have our risk takers, some more than others, and taking risks. We won't delve into that today. That's another topic, but it is a personal choice, and there's different levels of risk. So certain things are more risky than others. And then lack of sleep, and that's another probably whole presentation that could be done. Ways to get sleep and how that affects, and how seniors have different things that might affect their ability to have that good night's rest. Okay, so I'm going to go into a little bit more detail of some of the falls risks. So we're going to do a few little categories. So these couple of things are things we can't change, right? So it's just kind of for information to kind of know. So age, if you're below 65, low risk. And if you're 65 to 75, we're looking at moderate. And then over 75, you're at that high risk category. So that doesn't necessarily mean you're going to have a fall. It just means we have to kind of look at these prevention pieces even more carefully in that age, because the rates are more likely into that age group. And then gender. Females are at high risk. Don't we have the bad parts of everything sometimes, hey, feels like. So females are at high risk for falls. So assisted devices. So that would be like a walker or a cane. So if you don't have one and you don't really need one to walk safely, and the doctor or your physio hasn't recommended one, then that puts you at a low risk category, right? If you have one that was prescribed and fit for you, so you have a gait aid, a physio came, looked at it and said, yep, that one's good for you, and they got the height correctly, and someone taught you how to use it correctly, because there is some little tips, which I'll give you later, then you're in that moderate category. So it's not, the use of a gait aid doesn't put you at risk, it actually decreases your risk, right, in a lot of cases. So the high risk category was if you use a gait aid, but no one taught you how to use it or kind of measure it for you, that would actually put you at a little bit more risk. Or we call this furniture surfing. So if you're using your hands and on the walls and the furniture as you're going by, you don't have a gait aid, but you've noticed yourself kind of needing those surfaces to keep your balance. And then previous falls, and this can really put you at risk. This is the main question that us healthcare providers ask. Have you had a fall? Usually it's actually in the last 12 months, because even the last year can be a risk. So if you haven't had any falls in the last 6 to 12 months, you're lower risk. If you come in around 1 in that last 6 months and no injury, so you didn't hit your head, you didn't need to go to the ER, you didn't have any broken bones or anything like that, then we're in that moderate category. If you have just 1, no injury, it's not too much to worry about, but something to think about. But if you have 2 or more falls in 6 months, or you've been injured, had to have that kind of doctor's visit because of an injury related to a fall, then we're looking at that higher risk category. And this is all, just showing the importance of when you're needing this little, the prevention and the interventions. And then physical activity level, which is why we're going to talk about exercise later. If you do 30 minutes, 5 to 7 days a week, you're in that lower category. If you're doing it 15 minutes, 2 to 4 days a week, you're in that moderate. And then not active at all puts you at a lot of risk, because we talked about all those things that could potentially decrease with age. And then if we don't exercise, that kind of exponentially, we'll see that rate go down, that muscle strength, that balance, the stiffness and the tightness in the muscles, that's all gonna kind of be worse off if we don't have that activity in there. So I'm going to hand it off to Corinne now for a few slides.
Okay, hi. So I'm going to talk about some more risk for falling before we get into some preventions we can do at home. So eye care is an important one. And as we age, it is normal that we experience vision changes. Our eye health will need to be assessed regularly. So the research suggests that you're at a lower risk for falls if you have your eyes checked at least once a year. And your risk increases to high if you go 3+ years without having your eyes checked. It's really important that your vision health be looked at because as you age, things may get blurrier, a depth perception may change, and it's really important to see what types of glasses you might need, or whether, you know, you may have cataracts and that needs surgery, or anything going on with your eyes in terms of health. The other risk for falling, and it does include medications, which Brittany spoke about earlier. And for some of us, you know, as we age and our health may deteriorate, we may need those medications, but people are considered at higher risk for falls if you're on 5+ medications. So we're going to give some more information about that a little bit later. So we wanted to mention footwear, because it is really important that your shoes and slippers, if you're wearing them in the house, have these important qualities. So you need a firm heel counter, a smooth lining inside. You need fastening, you know, your shoelaces should be firm and adjustable. The forefront of the shoe needs to be flexible. It shouldn't be too rigid. You need deep and wide toe box, a low heel and synthetic sole. So if you have slippers and shoes with these qualities, this will give you a solid foundation for walking and decreases your risk for tripping and slipping, which can lead to a fall. So we know that many seniors are injured at home, and that's why, you know, there's rehab in the community for clients at home. And 50 to 60% of those falls that we know about are occurring at home. And falls are often due to hazards that are very easy to overlook, but also easy to fix. And we will give you tips on that. And there are many changes that can be made in the home to help you prevent falls that will be beneficial not only to you, but any family members or caregivers that help you at home, and also visitors that you may get in your home. So I would like for you to review this picture and make a note to yourself, identifying as many hazards as you can see. And then when we go through the next several slides, you can see how many you were able to identify. So let's just take a minute or so to do that.
And do you see that thing showing up in the middle of the screen?
I do, yes.
Yeah, I'm trying to figure out how to get rid of it here now. I've never seen it. I don't know if you guys have.
No, I've never seen it.
I'm wondering if I might end the presentation, just see if that'll. Stop share for a moment.
Technology.
We said that, didn't we?
We did. We jinxed it.
Okay. We're good.
Thank you.
Okay. So now can everyone see the picture well? Okay. Just take a good minute to look at everything. It's a very busy picture, isn't it? Okay, so let's move on to identifying some of the hazards in your home that you may be aware of or you may not. So inside the home, loose rugs and extension cords, especially in high traffic areas, present a high hazard for falls. Any uneven surfaces, raised door thresholds, or any changes in flooring, like if you have a different flooring in your living room versus your kitchen and that type of thing, can be very challenging. So especially, you know, when you aren't able to lift your feet as high when you're walking, if you have the wrong types of shoes on, or even if you have a walking aid, that can present as a hazard and a risk for falls. The finish on your flooring can be slippery sometimes, and depending on the socks you wear. So if you're wearing cotton socks or wool socks, that can present as a hazard. Dimly lit areas everywhere. So in your rooms, your hallways, on the stairs, if you're going to your bathroom at night from your bedroom, anything that's dimly lit prevents you from seeing any obstacles that may be in your way and can present as a fall. Obstacles in high traffic areas. So you've seen in that picture, things on the floor in your way, especially in your routes of travel. You need to get those obstacles out of the way. And pets. We've also seen people fall because a pet will get underfoot and you'll lose your balance and have a fall. Stairs is another common area of your home that can be a challenge as we age. And having no handrails, so nothing to hold for support, poor lighting, again, you'll see that as a common theme throughout. The type of step you have, so a narrow step in width and depth can prevent your foot from landing securely on the step. And having no nosing or edging also doesn't often let you know where the end of the step is, so that can present as a hazard. Removing that clutter on the stairs is important. And also removing glasses when using, so glasses are kind of twofold. So if you have reading glasses, you shouldn't wear them on the stairs because you should only use reading glasses for reading. However, if you're giving glasses because you need them to see better, then you shouldn't remove them when you're using the stairs. Okay. And sometimes we go up and down the stairs, especially if, your bathroom and your bedrooms are up on the main level on the top level of the home, you're always carrying objects up and down, and sometimes we just overload and we aren't able to hold on to that handrail that's there, hopefully. Next slide. Another thing we sometimes don't think about are the types of doors we have in our homes. So doors can also be a challenge if they're heavy, if it's difficult to lock, if it's a sliding glass door. That can throw you off balance when opening or closing it. And you can sometimes, if you have a high threshold or sill, you can misjudge the height of that higher step. And in the hallways leading to important areas of your home, if they are cluttered or have poor lighting, that is a high risk. And mirrors, and sometimes we don't think about the mirrors, but they can distort your path of travel and increase your fall risk. When you look at storage areas in your home, you need to be mindful of where you store the frequently used items. So heavier items in higher cupboards, or if you have items that you need often and they're difficult to reach, they may throw your balance off as well. And the types of chairs that we sit in at home. So those rocking chairs that we all love, those chairs with wheels, they're going to move when you try to transfer in and out of them. And that will decrease the stability of your transfer surface. And if you are trying to transfer into a chair that doesn't have arms, that can also put you at risk. So armrests are often due because we need them as support to transfer. And if we have some lower leg length strengthening, so if we need to strengthen our legs and we aren't quite there yet because we haven't started our exercise routinely, then sometimes you just need those arms to help you transfer. So if you don't have a chair with an arm, that can put you at risk. And transferring from lower heights is often more difficult as we age too, if you're not maintaining your strength in your legs. And here's the lighting. So you can see the different, what's good and what is bad. So any lighting that is poor or causes glare will prevent you from seeing obstacles or distort the images. And inaccessible switches is also another hazard in the home because you may not be able to reach the switch or it may not be in the right spot for you. So even though you might have the light available to you, you're not able to access the switch to light up the area you're going into. The bathroom is another high risk area in your home that needs some attention. So anything like if you spill any water, powders, oils, not having a bath mat in the tub or shower, they can all increase slips and falls. No night light. If you're going to the bathroom at night, you need that area well lit. And if you are depending on a towel rack, for example, to support you when transferring on and off the toilet, for example, you need to remember that anything you use for support needs to be secure. Grab bars need to be installed in wall studs, for example. You can't use towel racks. They aren't safe. And in your bedroom, there are some hazards in there. So you need to consider the height of your bed. If it's too low or too high, like we go into homes often and we see clients having to use step stools to get into beds because the beds that they have now, the mattresses are lovely, but they're extremely high. So lots of times we're recommending, you know, a low profile box spring, a lower mattress, and those types of things. So if you're buying a new bed, consider that. Consider the height of your mattresses. Having an inaccessible light switch is another concern, and of course, those cluttered pathways. However, despite all the risk that we've already talked about, there is good news because falls can definitely be prevented, and there's lots of things that we can do. So as many as a third of the falls related adverse outcomes are actually preventable. And there are many ways to do that. We can modify the task by changing the method. So for example, you can do less laundry per load. You can sit when you're preparing meals and cutting vegetables. And there's lots of changes that can be made to the environment. So moving objects to lower accessible shelves, for example, and removing those scattered rugs. And of course, we can change the frequency of tasks that we do throughout the day. So you may do laundry less times in 1 month or more if smaller loads is more manageable for you, for example. So there's all kinds of different ways that we can modify tasks to help ourselves. So we're going to run through some of those high-risk areas and look at how to make your home safe and prevent falls and injury. So we'll start outside your home. It's very important to keep your front steps, bridge, and walkway in good condition and free from snow, ice, and leaves. We do see a lot of falls in winter, so it's really important that you consider who is clearing your pathways and make sure that you decrease your risk there. Having an entranceway that is well lit is also very important. And there are things you can do if you have difficulty with your steps. Lots of homes have stairs to get into, so you can consider a ramp or steps with a landing to rest. And you can also look at installing handrails. Handrails might be all you need to help increase your safety on stairs. And of course, look at your doorway threshold. So if that's too high, you may need even just a little threshold ramp to go to your doorway. On the stairs, please make sure they're well lit. You can install handrails on both sides to have that external support that you need. You may also need to put marker strips at the edge of the steps so that they're easier to see. And steps should also have a non-skid surface because that will help you avoid misstepping. Remove those reading glasses. They're going to throw your depth perception off and you're not going to know where the step is. And never rush up or down the stairs. Rushing is a major cause of falls, and definitely watch what you're carrying up and down the stairs, so don't overload yourself. In the living room and bedroom, look at the clutter and hazards around. Make sure cords and floor mats are removed or secured. It's important to consider a cordless phone. You should have a phone nearby. So we're, near your bed, near your sitting area, in the event of an emergency, or if the phone rings. You don't want to have to rush to answer it because that could lead to a fall. Make sure you have good lighting in all rooms. You can have a lamp, you can have light switches near your bed, for example. Night lights are another good thing to have. And again, keep all those paths clear. Get rid of the clutter. Keep your walkways free from all objects on the floor. You should have very clear pathways. And when you're getting up from a bed or a chair or the toilet or, you know, a shower seat, anything you're transferring from, just make sure you do so slowly in case you do get that fluctuation in your blood pressure and those things. If you get up slowly, you kind of see how you feel and you get your balance about you, that will help decrease your risk. And non-glare and non-slip flooring, it's supposed to be, not slop, would be helpful too to prevent those falls. I had noticed a couple of spelling errors, sorry. In the kitchen, so this is a very important place in our homes, especially for Newfoundlanders, I think. So it's important to keep items that you use most in easily accessible areas, that easy for you to reach. So that would be between knee and shoulder height. So to kind of give you a gauge of where you should be setting up your kitchen. You need to store heavier items in lower cupboards, but avoid putting them below knee level because it makes it more difficult to get them out. Secure and remove, I would prefer you remove your kitchen mats if you could, and always wipe up spills immediately because that's a high risk for a slip and a fall. There may be some tasks that you need help to do, and it's okay to ask for that help. And there are little pieces of equipment that we can also use that may help us. So a stable step stool with a safety rail, if you need to reach a higher place for an infrequently used item, that's what you should have up there. Could be used if you have the balance to be on that stool with the safety rail. Don't stand on a chair. And you can also use a reacher to get items out of your cupboard. And the bathroom is another place we see a lot of our seniors fall. So it's really important to use non-slip mats or strips on the surface of your tub and shower. Install grab bars beside your toilet and bathtub. Do not use those towel racks. It will not support your weight. Clean up any residue from powders or oils that you may use to prevent the slipping and falling. And there's so much bathroom equipment that can be put in a home to help increase your safety with transfers in there. So, you know, there's raised toilet seats that can be used. There's safety frames that can be put. Oh, I see something there. Okay, so will we answer the questions at the end of the presentation, I guess?
Yes.
Okay. There's different styles of bath seats, bathtub transfer benches, and tub lifts that can go in your bathroom to help you with transferring from the shower and tub. And your OT, your occupational therapist, can also do an assessment with you to make sure that you get the right equipment and it fits your environment, because that's very important. Sometimes we find seniors purchase equipment, but it's not quite what's right for them or fit in their bathroom. So this picture will show you some adaptive aids. The first one there on the toilet is a raised toilet seat with a safety frame. So you can get all kinds of different raised toilet seats. You can get just safety frames. There's all kinds of options for toilets. The gentleman holding on to that pole, it's called the transfer pole, and that can be used to help you get in and out of bed or a bed rail. The tub, there's all kinds of equipment for the tub that I just spoke about. And then to increase your independence and safety when you're washing and dressing yourself, there's long-handled equipment aids. So you see there's a shoe horn, there's a long-handled sponge, and there's a sock aid there as well that can be used. And we did ask that at the end of the presentation, those in attendance would receive this Staying Independent checklist. And there's a home safety checklist that we thought would be helpful for you. It would give you something to think about and really look at your environment closely and see what changes you can make for yourself to decrease your risk at home.
Okay, back to me. So, since we were talking about some adaptive aids, naturally the next thing we'll be talking about is walking aids. So there are various types, and these are just some of the signs that you might be needing one. So ways to kind of know without even someone telling you that you might need a walking aid. So if you've fallen 2 times in the last 6 months, probably a good sign. If you're using furniture and walls to steady yourself, if you get frequent dizziness, that isn't just, if someone was having it just when they stand up and then it fades for a moment and you're able to just kind of take your time and then go on. But if you're having dizziness, that can come and go at any time during walking, that might be a sign you need one. And then if you're real fearful and worrying about falling, and especially if that's limiting you from doing certain activities or going certain places. And that's why I say that oftentimes gait aids, they don't remove independence, they add to it, because we're naturally not even realizing that we might be kind of avoiding some things because of that fear of falling. So some of the benefits of walking aids is it can help to reduce falls. It can improve stability and safety. It can improve endurance, because what happens is if we don't have that walker, the best example I have is the rollator walker as pictured there. So with the seat, so some people may be worried or not feel like they have the capacity to rock longer distance. But if you had that seat with you, you may be able to go that longer distance and actually get your endurance up even more. So having that little extra comfort and safety will allow you to actually increase your ability to walk. It can help improve your overall function. It may be that you have pain in a knee or in a hip and you find yourself limping a lot and it just causes a lot of pain. But using a gait aid, all of a sudden it's actually a little bit easier and you're experiencing a lot less pain. And then overall just can increase quality of life if we're engaging more fully in life, if we have that extra security when it's needed. So because the rollator walker is a really common one to see, it's one of the first, cane would probably be the first thing. And then we're kind of looking at that rollator because it gives you some options of having that basket and having that seat for doing longer distances. So I just kind of wanted to do a quick review of how to safely use one of the rollator walkers. So brakes are super important. That's anything with four wheels, we want to have those brakes. So you press down to keep the brakes fully on, most models, but pretty much 90% of models, that's the case. And then they have bike brakes for like if you were going down a ramp or something that you could squeeze. But if you're leaving the walker or if you're going to sit on it, we want to make sure those brakes are pushed down and locked in. When getting up from any surface, we want to make sure those brakes are on, but we also want to push up from the chair, couch, or bed, the surface that we're coming from. So we're not meant to kind of pull up from, use the walker to pull because they're tippy, right? They're not designed to be an actual transfer assist. So they're going to kind of pull back or tip sideways. So what you do is you push up through the surface that you're on, and then once you're in standing, lay your hands on the gait aid. When you're walking, you want to stand tall, push the walker forward, and walk by stepping between the back wheels with each step. So you're pushing the walker forward, but you don't want to have it so that, your bum's stuck out and your arms are outstretched and the walker's kind of getting away from you. And there's actually a cool addition to walkers that you can put slow down brakes. So if that was the case, if it was kind of getting away from you, we could kind of put something to put a little resistance on the wheels so it doesn't go so fast. But you can also have the brakes to use. So using the walker seat, as I said, you want to make sure the brakes are locked, you push them down, and you have to make sure you do that before you're doing your turning. You can position it against like a firm surface, like a wall, depending on if it's available, but it is, it's safe to do so. Otherwise, you just kind of think about it a little more when you're sitting, because sometimes we have a tendency to like plop down, but if you don't have that wall behind you, you want to make sure you do a nice, slow, controlled holding onto the handles. So you want to do your kind of turning. So you're able to turn by keeping one hand on the rollator. And then once you're back on, you get your two hands and then you sit down. Also really important, it actually says it on all those, pretty much all those rollators. The seat is just to take a stationary rest. It's not for transportation. So it's not to kind of scoot yourself around on or have people push you on when you're sitting. There are other things called transport chairs that can be used, or there are specifically designed rollators that are designed to be both a transport chair and a rollator. They're a little bit bigger, but they can be safely used as both. But your typical one that you're just going to buy, from your pharmacy would be that you don't sit and move. So now we're going to go into another piece I talked about before, the importance of medication management and falls prevention. So I'm not a pharmacist. I'm just going to direct you to where to kind of go. So that would be either your family doctor or your pharmacist. So if you're having issues with dizziness or recurrent falls, medication's always a smart thing, a pretty simple thing to just get checked to see. So usually that would be in the form of like a medication review, which family doctors can do that, but also pharmacists can do that. And I meant to check before we started here, but I believe those are, the medication reviews are covered for those above 65, so through pharmacists. So these are just some of the questions that's important to ask. And this might be, once a year, you kind of talk to your family doctor or pharmacist about the medications that you have. So, asking if any medications have been added, stopped, or changed, and why. Just kind of having an informed knowledge about what medications. What medication do you need to keep taking and why? Because some can kind of be prescribed and there's no real end date to them, but they may be able to be discontinued. But you have to make sure that you do that in consultation with doctors and pharmacists. And that's what the next, when you do get a new prescribed medication, how long do I need to be taking this medication? Right? They might be able to give you a time frame or a time frame to kind of check back in with them. And how will I know the medication isn't working? So is there a specific way? And it might not be, it might need a blood test or something like that to really know, or the doctor might need to be able to tell you those things. So just kind of having that conversation with them so that you feel informed. So there's other kind of med recommendations. So you can also use pill dispensers, like those ones with the days, just to make sure that you're limiting mistakes, because mistaking medications can also put you at more risk for injury and falls. Keep a list of your meds, in your purse, just so you always got a copy of them. And ask some of the questions about side effects as well. And then if you're kind of still find it hard to kind of organize in those weekly dispensers, then there's always those blister packs that they can do up for you. So it just has it all done out morning, evening, night. If you have a lot, that can be a really great tool to have as well. So just make sure you talk to your doctor and pharmacist about those. So we've talked about some of that mitigation. So before I go into some of the exercise pieces and prevention, I just want to talk about, okay, how about if you do fall? Because one of the really important things is how to fall a little bit better to prevent injury. If, sometimes it happens so quick, there's nothing really we can do. But if there's kind of these things are in your mind, and then how do we get up from the fall? So we're going to go over those couple things. So you want to try to land on your buttocks. So if you kind of land back on your bum, you got a nice soft cushion, right? That's part of what it's designed for. So falling on your side is where you're gonna have more risk of having a hip fracture. So trying to come down on the buttocks. Don't rush to get up. Make sure that you're not injured. So if you do, have that fall, you're down on the floor, just kind of take your time, take some deep breaths, and do little movements and just see if you're feeling any pain, if you're not able to move something. Because if that's the case, you may just need to call someone to help, whether it's, the actual ambulance or a family member. And then we want to make sure that you don't let that fear of falling again stop you. So that's why we're talking about all this prevention and ways that we can do to help. Because if you do have a fall, and we can put all these things in place and kind of make it so that you feel comfortable again, that's going to put you in a better situation. It's going to make you to continue to be active, which is going to further decrease your risk of falling. If you don't have that fear, that's going to further decrease your risk for falling. So don't let that kind of be the thing that makes you avoid everything. That's just your kind of sign you need a few extra little tweaks to your day. So just remember that inactivity will increase your falls risk, as I just said. So this is our typical way to get up from a fall. This is, you know, probably the best case scenario, and it might, like I said, you still might need to be calling someone. So you want to prepare so that you don't hurt yourself anymore. Look around, find some sturdy furniture, like you can see like a good chair, like some of those kitchen chairs. A recliner is not a great, just because it's like rocking and it can kind of, some of them kind of spin. So even like a couch or a chair would be best. And then you're going to try to turn your body from top down towards the furniture. So you can see that first picture kind of turning over. Then we're going to try to rise. We're going to push up your upper body, lift your head, kind of get up and steady yourself there. See how you feel. Slowly get up on your hands and knees if possible. You know, if you do have an injury of a hip fracture or something like that, you're not going to be able to do this and you're going to need assistance, but you know, you're feeling good. Place your, and if I always say in this case too, because people with, you know, significant knee arthritis, this can be really tricky. So if you see like a blanket or something like with a bit of cushion, you can always kind of pull that down and get it under your knees to make it a little bit easier to get up on those hands and knees. And then you're going to lift, you're going to have your hand on the surface of the chair, as in this picture here, and you're going to try to put one leg up. So you're going to get that one leg up in this position. And then we're going to try to push ourselves up through those legs and the arm to get yourself into a seated position. And you're just going to sit there for a few minutes before even moving again. Here, you're going to call a family member, a friend, or an ambulance to get assistance if you're still not feeling well. If you take a few moments and then you're feeling okay, then you can kind of try to get up. And then get assessed by a doctor, physio, or occupational therapist as well for any kind of falls risk and what we can do. So exercise. There's plenty of benefits of exercise, but these are specifically for seniors. So we want, it's actually, you know, the research has shown it has a potential decreased risk for dementia. So keeping that blood flow going and moving and being able to keep your brain active as well, while oftentimes physical activity can lead to social environments as well, and being out and doing things that kind of work our brain. You can increase your muscle strength, improve your balance, maintain heart health, and that might, you know, look like decreasing your blood pressure or your cholesterol. Slowing that progression of osteoporosis so that, you know, the bone density, make sure you're maintaining that bone density as long as possible, and then maintaining your flexibility as well. So this is one of the things that I always talk about, because I'm trying to get the word out about exercise and arthritis and how important it is, because oftentimes when our joints get really stiff and they're painful, we tend to start to avoid certain movements because they cause pain, and rightfully so. Like, you want to make sure that you're not kind of hurting anything else. But if we're looking at just arthritis and you've talked to your physiotherapist and gotten some exercises that are appropriate for your condition, then it's only going to be beneficial. So arthritis, as we can see with the picture, this is our healthy knee. So this is what we call articular cartilage. And we're going to see with arthritis, we have a little bit of wearing of that over time. So we still have this meniscus, which provides some lubrication to the joint. So here with arthritis, we're just looking at our articular cartilage. So what exercise can help with, it can strengthen the muscles to help kind of alleviate stress placed on your joints in general. But then that movement, because this meniscus works like a little sponge. So you might have heard the term motion is lotion. So by moving the joint, it actually helps to lubricate and make it less stiff. So you might find those first few exercises that you do a little bit stiff and painful. And then the more you do, it actually feels a little bit better. So really important. And then you can kind of decrease that stiffness, which will allow you to walk and function a little bit easier. So here are some of the recommendations. So this is coming down from, these are the Canadian guidelines for seniors over 65. So there's a bit of a range. So it's about 30 to 60 minutes per day, about 3 days a week. So what you want to add up, you'll see there, is 150 minutes a week. And then if you're doing a bout of exercise, as long as you can do 10 minutes or more at a time, you're going to get benefit. So if you do it for like 2 minutes, you might not get so much benefit. So you want a little bit of a prolonged period where you're getting your heart rate up and you're getting a little bit of challenge there. So even a 10-minute bout of exercise, like a walk, can be very beneficial. And then you can try to add that up throughout the week to see if you can get those 150 minutes a week. And that is including, we're going to look at 3 kind of types of exercise. So it might not look the same every day. It might not be a walk every day, but it might be. So we'll kind of incorporate aerobic, which is cardiovascular type exercise, where we're trying to get that heart pumping and blood flowing. So walking is a great way, swimming or water aerobics, and that can kind of take a little bit of pressure off the joints if that's what's finding it difficult to exercise. And then you can get like these little recumbent bikes, or even just a little, you've probably seen them on TV, the Cubies, or I call them a chair peddler, because you can get other brands just like at Walmart and Canadian Tire. So it's just something you could sit in your chair and you can kind of move your legs like a little bike. So if you kind of put a little bit of resistance on those or have a little bit of speed, you want to get your heart rate up a little bit. So one of the, how you kind of, because you want to go into a bit of moderate intensity there. So the great way to kind of know you're in that right zone, your heart rate's up, your breathing's up a little bit, but you can still talk. So if you were to kind of try to have a conversation with someone, it's not like, that would be a little bit too intense. So if we can kind of get that heart rate, that breathing up, but still be able to talk, then we're good. Okay, the next type of exercise is strength. So we need to incorporate this at least twice per week to have your benefits of strengthening. And some examples. So you can get exercises from a physiotherapist that does some strengthening, but you can also just, if you can do your stairs a couple of times, not just doing them, okay, I just went up the stairs and brought my laundry up. Even if you kind of got to go up and down a couple of times, whatever's within your abilities, using some light weights or bands, wall push-ups. You literally just put your hands on the wall and kind of do a little push-up. Sit to stands are a really great one, because how many times we have to do that in the run of a day. But also not just, okay, yeah, I stood up a bunch of times today. Trying to do some repetitions. So you want to look at doing your 8 to 10 repetitions to really see that benefit. So it's not just kind of getting up, going off and doing something and then sitting down again. You want to get some repetitions in there. And then there are exercise classes. So even like City of Corner Brook does like seniors exercise class. There's a variety of different like chair yoga and stuff as well. And then balance exercises. So something like gardening is actually great, because you're reaching, you're bending and twisting. So you're kind of challenging that standing balance a little bit. And then there's exercise you can do at your kitchen sink that we kind of do. We'll hold on to the sink and you'll do a little bit of marching, standing on one foot, those kinds of things. And that's very common for me to prescribe to some of my clients. So the importance about balance exercise, it needs to be challenging while staying safe. So that's why I say at the kitchen sink, because we do want the exercise to feel like if you didn't have that sink there, it would be pretty challenging. If it's super easy and you could go on and no issue, then it's not quite hard enough. And that means we're not going to get those gains. So we gotta make sure that. So another thing we're going to get sent out after this presentation is a list of the 24-hour movement guidelines for 65 plus. This is the Canadian guidelines I talked about. So it just gives you that 150 minutes a week, talking about how much sleep we're looking and how to limit our sedentary behavior as well. So trying not to sit too much time in front of the TV, say, you know, getting up in between, breaking it up, making sure we're at least doing some activity. So we'll send that out as well. So we're coming to the end there now. So when is it time to get assistance? So we want everyone to stay independent as long as possible, right? So this is just, everyone has their kind of, okay, this is the thing that's going to make me say, yeah, I need help. So having that conversation even with family members is really great. Like, what does that look like for you? Does it look like that you're not able to drive anymore, so you need someone to kind of come in and help you with that? Or like I said, it's very individual. So some examples are, you know, if you're having increasing frequency of falls, if you're not able to drive, poor memory, having trouble managing your medications, or you can't cook for yourself. And some of the options would be like seniors apartments, home supports, long-term care is kind of right at the end, right? Like that, you're needing a lot of assistance. So that's why we're putting a little bit of everything in here. Certain retirement facilities or full care homes, like your personal care homes. And that would depend on your need, right? So we have some community support professionals, us, myself and Corinne included. So that could be social work, nursing, OT, PT, EMS, LPNs, and we have a rehab assistant who helps with exercises here as well. And then we have a certain philosophy of care that you kind of see that we want to keep people safe in their home as long as possible. And that's what all these kind of risk stuff can really help to do. So we know that people tend to thrive better at home. So if we can kind of keep all these prevention things in mind, then we're going to make sure we do that. So when to see your local physio. So that could be myself in community, that could be a private physio, that could be outpatient. There's lots of different, depending on where you are in the province and what's available to you. So if you want to know what your risk is for falling, if you want to measure and learn how to safely use an assistive device, if you want to learn some exercises that you can do at home to help improve your balance and increase your strength, and if you want to learn how to adapt activities so they're easier for you to do. Corinne's going to talk about OT. Can't hear you, Corinne.
Sorry. You can also self-refer, or a family member can refer you to an occupational therapist. And some of the reasons you may want to see an OT would be to increase your safety and independence to complete ADLs at home. So when we talk about ADLs, we're looking at toileting, showers, transfers, those types of things. Increase safety and independence to complete your IADLs, so like your laundry, cleaning, cooking. Learn how to adapt activities, modify activities, pace yourself at home to decrease your risk for falling. You may need some equipment in your bathroom to help with showers or making toileting easier. You may need a ramp or bathroom modification. A lot of programs will require an occupational therapy letter of support for that. And just to help you identify fall hazards in your home and identify any changes that you can make to prevent those falls. And we would like to leave you today with a quote from Abraham Lincoln. So, and in the end, it's not the years in your life that count, it's the life in your years. So therefore, all the prevention measures that we talked about today, we would like to leave you with those and hope that you stay active and address the hazards in your home.
Thank you, guys. That was great. A lot of information, which is fantastic. And I don't see any questions in the chat. Can everybody hear me okay? So please feel free to throw any questions that you have into the chats. What we have put in there now, so there's, you referenced 3 documents that you shared with us. So those 3 documents we will send out to everybody who registered by email as attachments. Also, we included a couple of things in the chat for everybody, because you'll get a copy of that. So there is a provincial home modification program that is available. Included in the information shared was who's eligible, what's required for that. But if you ever need to think about making some changes to your home in order to improve your safety, check that out in the chat, including contact information. There's also a provincial special assistance program for anybody who might need certain things such as wheelchairs, walkers, et cetera, and I'm sure Corinne and Brittany could wax way more poetic on that than I can. But that is a provincial special assistance program that's available, and there's some information in the chat for you on that. And if you want to look into that in your region, just give us a call at Seniors NL, and we'll provide you with contact information for wherever you are for the special assistance program. And the last thing we put in there is that in addition to the medication therapy services that you talked about, there's also one at Memorial University, and the School of Pharmacy does that too. So if anybody wants to take advantage of people taking a look at your medications for you, to reviews, to help you make sure that it's not maybe contributing to that, there's also information in the chat and a contact number if you want to take a look at it through MUN. Noreen, lots of good information. Jessica, thanks so much. Is it possible to send a copy of the slides? The answer to that is a big yes. There will be slides going out and the video. So probably tomorrow, we'll have to wait for it to upload, and we'll send the slides and the video and the 3 send outs as well.
And maybe I'll send you, because I think we can I'll create a PDF for the slides, and it might be easier for people to read down through.
That would be perfect. Yeah. And if you guys, and if anybody has any interest, like other things that were not talked about, but for example, are a possibility. And a lot of people some people seem to gravitate to them and other people struggle with it, is the medical alert systems. And sometimes I think people just don't like people seeing that they have it around their neck because maybe it says something. But the reality is that those are incredibly helpful. There's a number of options that are available in this province to people that also offer a bunch of other services as well. So if you want to look into a medical alert system, don't hesitate to call us. And I'm wondering, Brittany and Corinne, the getting up from a fall, do you have any access to any actual video or heavily detailed imagery of getting up from a fall? Like, is there more that you could share? Because if I went down and then I saw somebody actually doing it in a video, I would really understand that better. And
yeah, sure, I can send that. Yep.
Great, because we'll share that with everybody as well. That would be fantastic.
I know what I went over, I kind of broke it down. It was a handout, so I can send you a handout, and I'll try to see if I can find a video as well.
That would be fantastic. Okay. Well, it looks like there's anybody have any questions before we say a big thank you? I'm going to share my screen now. So thank you, Brittany and Corinne, very much for so much information that I take some time to digest, but it's fantastic. And thank you to everyone who joined us. Really grateful that you were able to spend your morning with us and part of your morning with us. We're doing certificates, of course. So if you attended as part of a professional development or educational requirement, we will send you a certificate of completion. Just send an email to us at outreach@seniorsnl.ca. And if anybody wants to be a friend of Seniors NL, which allows us to connect older adults to the kind of information that can help them make informed decisions, things such as the home modification program, et cetera, then if you want to be a friend of Seniors NL, again, an email to outreach@seniorsnl.ca is great, or 737-2333 or 800-563-5599. and we can tell you more about it and help us reach out to more seniors. And speaking of, here's some more contact information. So on that note, is there anything in the chat that we want to? Nope. Lots of great information. Thank you. I think we're going to call it. Thank you very much, Brittany and Corinne. Fantastic.
Thank you, Brittany. Thank you, Corinne.
You're very welcome.
Have a great day, everyone.
Bye.
Bye.
Bye. I'm going to shut her down.